What if you thought you had the flu, but after going to the doctor, you learn you have hepatitis and must now learn to live with it? 5 million Americans are affected by chronic hepatitis B and C. Hepatitis is an inflammation of the liver and can be caused by a wide range of things. Hepatitis B and C are two viruses that kill approximately 1 million people a year, and 500 million people around the world are currently infected with hepatitis. On this episode of True Life, you'll meet 3 young girls who, because of their careless decisions, must learn to live with hepatitis. Find out on True Life, I Have Hepatitis.
Hi, I'm Stacy, and I have hepatitis A.
Stacy is a 27-year-old teacher who works at Palmetto Elementary School. While on a romantic vacation with her husband, what was known to be the most popular restaurant turned out to be the most unsanitary place. Now she is dealing with hepatitis A. Though it is incurable, the symptoms are undesirable.
And we were thinking, let's go to a real local place, someplace where authentic, because we wanted, some real authentic Peruvian food. So we found this little restaurant off the little beaten path, and this is going to be awesome. So I had these oysters and drank all this water, and it was delicious. And everything was fine until it was about a month later. After I got home, I was nauseous and just not feeling well. I kind of lost my appetite. So, I thought, I should really go to the doctor. So I just got out of the doctor's office, and he told me that I got hepatitis A. So I decided to go to my local pharmacy.
Hi, my name is Nicole. I have hepatitis B.
Nicole is a 26-year-old bartender who moved in with her best friend to have freedom from her parents. But now she's faced with having to tell her parents that she has contacted hepatitis B and needs their moral support.
About a year ago, I moved out of my parents' house and I moved in with my friend Jenny. Jenny is like my best friend. We do everything together. We go out together, we eat together, we go shopping together. When I first met her, she told me she has hepatitis B, and I didn't know what that was. I didn't think it was a big deal. So one day, I was gonna shave my legs, and I ran out my razor. So I asked her if I can borrow it, and so I was using her razor, and I got a razor cut. And it was bleeding, and it happened to me a lot, so I didn't really pay attention. And a few months later, I started feeling really sick. I was feeling nauseous, I was dizzy, I was throwing up, and I had a stomach pain. And then one day my friend told me my skin looks kind of yellowish. I go tanning, but I don't want my color to my skin to look yellow. So that really freaked me out. So I made an appointment with my doctor. I went to see my doctor the next day, and he did some kind of blood work, and he told me I have hepatitis B. In my head, I was like, oh my God, how did I get this hepatitis B? And my doctor told me I can get hepatitis B from, having unprotected sex. If you're a drug user, he said he could get it from, sharing needles. And then he told me I can get hepatitis B from, sharing razors. Then it just hit me, I was using Jenny's razor. Jenny has hepatitis B, and I got a razor cut from her razor, and I'm like, oh my God, that's how I got it. So now I have hepatitis B.
Hi, my name is Angelina, and I have hepatitis C.
Angelina is a 21-year-old student at the University of Florida. Like every other college student, she partied hard this last spring break. But what seemed to be a great idea at the time turned out to be the most regrettable decision she ever made in her life. She now has hepatitis C.
So 3 months ago, I went down to the Keys for spring break with my girlfriends, and we ended up going a little crazy and getting tattoos. A couple weeks later, I went to the doctor because I started feeling like I had the flu. My stomach was hurting, my skin was itchy, and I just didn't really know what was going on. And it turns out that I have hepatitis C. Having hepatitis C has really changed my life.
How?
Well, I have to take a medication now, and also I can't drink alcohol.
As pharmacists, it is our obligation to counsel our patients on the awareness and prevention of hepatitis. The most effective way to avoid getting hepatitis A and B is to get vaccinated. Hepatitis A vaccine is necessary for patients who travel to places of risk. Hepatitis A is transmitted via the fecal-oral route, household contact, sexual contact, and sharing contaminated utensils. Let's shift gears and talk about hepatitis B. Most states require this vaccination to be given as an infant up to the age of 18. This is most commonly transmitted through blood and other bodily fluids. Hepatitis C is the most common chronic blood-borne infection in the U.S. This is transmitted through sharing of needles, needle stick injuries in the healthcare setting, or sharing of personal items contaminated with blood. So we must be deliberate in taking action to screen patients who may be at risk. We should express the importance of minimizing the risk of transmission by refraining from blood donating, sharing of toothbrushes or razors, and making sure that they cover any open wounds. Together, we can make a difference by responding to this message.